Hello everyone, welcome to my channel. Today's topic is about sexually transmitted infection. One of the most prevalent sexually transmitted infection is gonorrhea. We are going to learn about gonorrhea. Let's begin from introduction. Gonorrhea is a sexually transmitted infection caused by Neisseria gonorrhoeae, which can be transmitted through sexual contact. The main signs and symptoms of gonorrhea are infection, inflammation of lining of genital tract, throat, and rectum. So, gonorrhea is basically a sexually transmitted infection that can be caused by Neisseria gonorrhoeae, a bacteria that is transmitted through sexual contact and characterized by infection and inflammation of lining of genital tract, that is reproductive tract. The infection and inflammation can also be seen in throat as well as rectum. Main causative agent of gonorrhea is bacteria named Neisseria gonorrhoeae. Risk group. The group which are at risk of having gonorrhea are mother who is infected by gonorrhea during pregnancy. She can transmit that infection to her baby during delivery transplacentally. The infection which is transmitted by pregnant mother to her child is called as transplacental transmission. Symptoms of gonorrhea are divided into symptoms in women and symptoms in men. First of all, symptoms in women. There is acute unilateral pain, that is one-sided pain, unilateral pain and swelling, same unilateral swelling over the labia due to involvement of Bartholin's gland. Bartholin's gland are a pea-shaped gland that are found in the outermost part of the reproductive tract. So the acute unilateral pain and swelling is found in the labia because of involvement of Bartholin's gland. There is excess irritating vaginal discharge. The vaginal discharge can be itching and irritating. Next is frequent urination, often with a burning sensation. The urine content of urine becomes concentrated because of infection. That's why urine comes out with a burning sensation during gonorrhea. Next is infection occurs in surrounding organs like urethra and rectum. Along with reproductive organs, infection can be seen in urethra and rectum, which are the surrounding or nearby organs of vagina. Similarly, symptoms in men are unusual discharge from the tip of penis, which seems scanty, light at the beginning, but becomes gradually thicker and heavier. Next is pain while passing urine. They also feel pain while passing urine because of infection. Next is there is acute pain in the testis, which is tender on examination. So during examination of male who are suffered from gonorrhea, there is tender testis. Next is lower abdominal pain. So these were the symptoms in men. Investigations for gonorrhea can be, first of all, vaginal examination of female. On vaginal examination, labia might look swollen and inflamed. And there also might be discharge, which is leaking out of the vagina. And the Bartholin's duct, same Bartholin's gland, might look congested or fatter than normal, thicker than normal. Next, on a speculum examination, there is mucopurulent secretion leaking out of the cervix. Mucopurulent is infectious, containing infectious organism. Such secretion are leaking out of the cervix. That discharge can be taken for culture and sensitivity test. culture and sensitivity test is performed to find out the nature of positive organism. Next, infection can spread up to urethra. Thus, urine examination can also be done. Infection can spread to all the nearby organs. So the most nearby organ is urethra. Thus, this infection can spread up to urethra. Management for gonorrhea includes, first of all, preventive management. Preventive management contains following points. If there is any gonococcal infection, it should be treated timely because same gonococcal bacteria can cause infection in reproductive tract. Next is, while treatment, male and female partners should be treated simultaneously. Because the infection is seen in both male and female partners, infection is transmitted by sexual contact. So, treatment also should be done simultaneously in male and female. Next is, practice of safe sex should be done. Use of condom while sexual contact can protect from all kind of sexually transmitted infection. Next, multiple sexual partners should be avoided. To avoid this infection, multiple sexual partners should be avoided. Medical management for gonorrhea includes antibiotics, first of all. That antibiotics, those antibiotics which are given as first line antibiotics are ciprofloxacin, ceftriaxone, and ampicillin. There might be some other antibiotics which are provided according to the policy of hospital or according to rules. But mostly these three group of antibiotics are given for treatment of gonorrhea. That are ciprofloxacin 500 mg, ceftriaxone 250 mg, and ampicillin 3 gram orally. Next is, medical management also requires follow-up. As there is an antibiotic therapy for a certain period of time, follow-up is necessary. Also, during follow-up, culture and sensitivity tests should be done time and again. They are called as a retest culture. Same vaginal discharge should be examined time to time so that presence of bacteria, presence of amount of bacteria can be determined. That way we can find out whether the antibiotic therapy has worked or not. This point says that monthly interval of 3 months should be followed for follow-up. And if the patient's report is consistently negative, at least for 3 times, consistently, that is continuously negative, then patient can be declared as treated from gonorrhea. Next is complications. If this infection is treated on time, follow-up is done, culture sensitivity test is done timely, then there is no complication. But if the treatment is not done on time, there might be some complications. Complications are divided into men and women. In women, complications can be cervicitis, infection and inflammation of cervix, salpingitis, infection and inflammation of fallopian tube, endometritis, infection and inflammation of endometrium, urethritis, same, infection and inflammation of urethra, and in a long term, infertility can also be seen. Whereas in men, there can be inflammation of epididymis, prostatitis, inflammation of prostate glands, and urethritis, inflammation of urethra. Thank you so much for watching.